This podcast is brought to you by the Association for Coaching, the world's leading international professional body which is advancing coaching in business and society worldwide. I'm your host, Maxine Bell, podcast manager for the AC, and I'm delighted to bring you this introductory series exploring mental health in coaching, aimed at both coaches and supervisors. I will be talking to coaches, supervisors and experts in this field to inspire and inform you towards better supporting your clients, as well as taking care of your own mental health and well-being. You will gain invaluable insights and practical tips, both for your professional and personal development, to help you coach better, building resilience and understanding in a stressful world. We will be discussing sensitive topics, so do take care of yourself and ask for help from a friend, colleague or professional if you need it. We will be providing a list of helpful resources and contact numbers on our webpage and in the show notes on the podcast channels, but do check your local area for help. Though informative, this podcast does not replace professional help or training. My guest today is David Britten. David is a dual-trained therapist, coach, supervisor and trainer whose work focuses mainly on the interface between therapy and coaching. As a trainer and supervisor, David helps coaches to expand the compass of their knowledge and competence by integrating ideas and practices from therapy and vice versa. David was the lead consultant on and the author of the BACP's Competencies and User Guide for Therapists Who Coach, which was published earlier this year. Welcome, David.
Thanks, Maxine. It's good to be here. Thanks for having me on.
It's lovely that you could be able to join us. I just wanted to ask you first, as I've asked my previous guests, what do you understand by mental health?
Yeah, I think the first thing I would say is that by mental health, I would understand more than the absence of mental ill health or mental illness. And I say that because I think there's still sometimes a perception that there's a fairly simple kind of spectrum from mental illness at one end to mental health at the other end, with various points in between. And sometimes there can be a sense that all we're trying to do around mental health is just make sure that people aren't actively unwell. My view, and it's not just my view, it's a fairly widely shared view in a number of fields, including the coaching field and areas like positive psychology, that mental health is also about the active presence of those aspects of our psychological functioning and our social situation and functioning that enable us to flourish, to have a sense of purpose and engagement with the world, to realise our potential, to make a valid contribution, and to feel an overall sense of coherence and satisfaction in our lives. So yeah, I think that would be my starting point.
So with that in mind, with you saying it's not just the absence of mental health, there are a lot of different mental illness terms that get used and kind of sometimes thrown around. So we're just to look into that more, the language that we use, why is that important, do you think, in regards to mental health?
I think for a number of reasons. I mean, one, I think it's important to know that the language around mental health and the language of mental illness is contentious, and that there are some people, perhaps particularly people who have had difficult experiences of the mental health system, or some of the people who've worked with them, who dislike the way what they might describe as human distress gets framed in a language of medicine and pathology. I don't have a really firm position on this, but I think it's important to be aware of it, that there are different ways of talking about what we refer to as mental health and mental illness, going back to the anti-psychiatry movement, perhaps of the late 1960s is probably where all of this stuff starts. And so, yeah, that would be the first thing. I think also, as coaches, we know that the language that we use shapes what we see, and that by reframing things in different language, we can disclose new aspects of situations and new possibilities. I think any language that we use will probably illuminate some aspects of a phenomenon, if you like, and obscure others. That just seems to be the way that language and thinking works. So if we want to really understand mental health, mental illness, and what coaches can contribute, I think it's good for us to be aware of the different ways, the different languages that can be used to describe these experiences and these situations, so that we're more we're more flexible and we have a more holistic understanding of the field of possibilities.
Yeah, and I think there can be a little bit of controversy in this area. I've worked in mental health situations, and sometimes there can be two extremes of somebody jumping in and labelling somebody. I've worked with young people a lot that got diagnosed with, say, borderline personality disorder, that actually were children that were actually just quite traumatised. And because it's still a developing area, there's probably still debate about when do you put that label on someone, and actually are you really getting to it? Does that label actually tell you what's actually really wrong with them sometimes?
There's a school of thought that around people who've developed ways of thinking like the power, threat, meaning framework, and there's an association called Drop the Disorder, who are very actively critical of the way that distress can get framed in a very medicalised language, and a language of disorder and pathology. And for those people, their starting question is not what's wrong with you, but what's happened to you. But I don't want to create the impression that there's a binary here. It's not the case that there's some hardcore kind of medical approach versus something radically different. There are all kinds of different shades within this, but I think it's important to be aware that the language we use can lead us to lose sight, perhaps, of the personhood of the person to whom the label is applied, and of the experiences that lie behind their suffering.
That's a really good point. I love that. Yeah, not what's wrong with you, but what's happened to you. Yeah, that feels more realistic to me, and a much more accurate question to ask. So thank you for saying that. I think that's really important. So from the point of view of coaches, we're in this topic and we're doing this series because there's been a rise in mental health issues. There's been a rise in suicides. So what do coaches need to understand about that term, from the level, how much they need to understand about mental health, do you think? We can put supervisors into that as well in that question, I think.
I think it is important to have an awareness of what are some of the symptoms and signs that are associated with more severe forms of psychological distress, whether we call that mental illness or not. And there are various books within the coaching field that offer some useful guides. The Buckley and Buckley book from about 2010, I think, has still got a lot of relevant information in that respect. So I think we need to be aware of some of the things that we might see that could give us reason to believe that somebody had a level of psychological distress that is out with the norm, and that is certainly beyond our compass, our competency, just as coaches. There's another very useful framework. I think, again, it's in the Buckley and Buckley book, that talks about differentiating between three different types of psychological distress, what they call functional suffering, dysfunctional suffering, and mental illness, where functional suffering feels broadly proportionate to the situation. We can identify what event or what set of circumstances is leading somebody to be experiencing psychological distress. We get a sense that it seems to be roughly proportionate to the situation. It tends to be short-lived, although it can be very intense. Dysfunctional suffering is the kind of psychological distress that either it doesn't sort of have a readily identifiable cause in the present, so we think it's not really clear why this person is experiencing the level of or the pain they're experiencing, or it seems to be disproportionately strong reaction to the events or the circumstances. I think it's a really useful distinction between functional and dysfunctional suffering, although we do need to be careful, because we're inevitably making a judgment about what we view as a proportionate response to a situation. And I've given this example before when I've done trainings on this, but my early days as a therapist, I just had a complete failure of empathy with somebody who'd been bereaved by a pet dying, and I at the time just couldn't kind of get myself into the headspace where this would really cause the level of distress that I was seeing. But that was more about my failure of empathy than it was actually about the person's experience. If I'd had this framework, I might have thought of that as sort of dysfunctional suffering. But there are all kinds of reasons why the person's distress was appropriate and proportionate. So we need to be mindful of our own frame of reference and the judgments that it might lead us to make. And then the third, just to finish on those three types of distress, the third one is what we would call mental illness or mental ill health, where you need a suitably qualified professional to make a diagnosis of some kind. For coaches, I think that distinction between functional and dysfunctional suffering can be very useful. And my view is that coaches can and probably should work with the functional suffering. And some coaches are often afraid to do so because they feel they're going to be getting into therapy territory. I know we're going to talk about that a bit more later on. But I think there's more that coaches can do than they currently do.
I was just thinking as you were talking, because something that's becoming very common, something that a lot of us have experienced at some point, is burnout. And I wondered, is that functional suffering? Where would you put burnout, or would it depend on how big a burnout you're experiencing?
Yeah, I think it would just depend entirely on the circumstances. I mean, certainly it's something that coaches are encountering more frequently, it seems, along with distress in general. Sometimes it seems to be, to use that framework, it seems to be a proportionate response to a really, really toxic environment and just perhaps an overload in life. Particular circumstances might mean that people are having to work longer hours. They might be going through particularly difficult processes within work as well as difficult circumstances in their personal life. But at other times, burnout does look more as if it's driven by some kind of psychological compulsion or a learned habit or behavior that's been picked up somewhere, that it's not the environment that's leading people to burnout. It's some kind of compulsive process within themselves. So I guess, and it's not like an either or, but I think that's one way of thinking about making a distinction.
Yeah, that's really interesting. I guess it's kind of what I observed during the pandemic was that for some people that was more traumatic than others, and that is probably linked to maybe previous trauma or previous experiences, as you've mentioned, and that's when it might seem disproportionate to us, but actually potentially not to that person, depending on what they're still carrying inside from previous events.
Yeah, and I guess for me that's why I think it's important for us not to jump to conclusions, but to explore that with the person we're working with. And you can do that in a way that doesn't involve you getting into doing therapy work. Just ask the question, is this familiar to you? Do you have a sense of what's going on here? Does this feel to you as if the suffering that you're experiencing is what anybody would be experiencing in this situation? Or do you think there's some more of you in there that maybe is something that indicates perhaps you might need some therapeutic support? I think coaches can have those kinds of conversations with people.
And I guess what I've observed when I've been involved in coach training is for some people that feels easier. Like for myself, I've had a history of working with people before I came to coaching, so those kind of hard questions, even asking about things like suicide, is not too challenging for me. But for other coaches who've never been in this kind of area, that's quite terrifying. Would you give them any advice on that, about how to approach that if they're feeling quite anxious or nervous about asking those questions, or having to even recontract in some way with somebody?
Yeah, I mean, I don't be afraid to ask those questions. It's really important to ask those questions. Explain, if you think it's going to be helpful, explain why you're asking the questions. Explain that you're not planning to do therapy or anything like that, but you want to get a sense of whether the person you're with is in a position to be able to benefit from coaching or not, and in order to do that, between the two of you, you need to be able to discern what's going to be possible and what's not going to be possible within the bounds of a coaching relationship. For me, I think one of the things that tends to be lacking in coach training at the moment, by comparison with therapy training, is the personal development aspect, which is a big part of therapy training. Whether you actually have personal therapy or not, you're expected to have a really good look at yourself. And part of that, well, there are all kinds of reasons for that, but one of them is just so that you understand where you learnt how you respond to other people's distress, and how your own experience, how you can use your own experiences to kind of resonate with people empathically. If your own grief or shame or anger or stress or whatever it might be is somehow not allowed into your awareness, you're going to find it very hard to gauge what the other person is experiencing and to offer them, kind of authentic empathy. And you're also more likely to get pulled into things like rescuing either rescuing people or shutting it down, or some coaches talk about just wanting to run out of the room if somebody cries, and I have huge sympathy for that, in the sense that if people are just not used to experiencing that stuff, it can be really frightening and worry that you're going to get yourself out of your depth. But I think that's just normal human distress that coaches need to find a way to be able to work with as just part of human experience, not as something that belongs in some separate box marked therapy or mental illness.
And to me, it's a little bit naive to think that you can work with people and never come across something where somebody might get tearful or upset about something. And my experience is similar to yours, that you just need to be brave, and you need to say, you can be aware, like you said, you need to be aware of what might trigger you, what you're uncomfortable with. But if you can own that in the moment as the coach, you're then not thinking about yourself, you're thinking about your client, and then you can ask that question. And my experience is that to avoid those questions will complicate things much worse than actually just asking, and even being honest and saying, I'm not quite sure what to do is better than pretending that you know when you don't. And sometimes you can do it through normal coaching questions, can't you, David? Like, I noticed you had quite a strong reaction to that thing I said.
Yeah.
Do you know why? Or, you can, this is what coaches were meant to be really good at, is it not asking questions? So
yeah, it is, but it's interesting. I've observed as a trainer, a lot of coaches, and for that matter, a lot of trainee therapists, managing just to avoid something that has been so clearly visible and sometimes almost explicitly communicated. I mean, on that issue of asking questions, the suicide question itself is important. And there's really good research from the field of therapy that a lot of therapists can feel nervous about asking directly, worried that they're somehow going to make it more likely that it's going to happen, or they're going to kind of put the idea in the person's head, and this is just not borne out by the evidence. It's actually, if somebody is feeling, touching onto some suicidality, having it named, finding words for it, helps to contain it.
Yes.
There's a guy called Andrew Reeves who quite a big figure in the therapy world now, but he did his PhD on suicide because, as a fairly inexperienced practitioner, I think he was fairly inexperienced when it happened, he had a client commit suicide, which doesn't happen that often, but it's horrible when it does, and he wanted to reflect on what had gone on and what, if anything, he might have done differently. And a big part of what came out of his research was the importance of naming it, so that if somebody's saying something like, it all just feels a bit pointless, or something like that, as a minimum, reflect what they've said. But if you think maybe somebody's just touched into a deeper level of despair, then check it out.
Yeah.
They're not going to say, yes, you're right, and walk out of the room and harm themselves. You're actually helping to contain it.
Yeah, and we've got a whole episode on that, particularly on suicide ideation, and so we'll be able to give coaches more tips on that, so that'll be really fantastic. But thank you for bringing that up already, because I think that is a common thought in someone's head. Yeah, you just need to ask the question. I mean, I've been very fortunate, right from when I was a nurse, to be with people with their most vulnerable times. I can vouch to the fact that if you're just brave enough to say what really needs to be said, it actually takes the weight off the other person's shoulders. Often I've noticed. Often I'll see the body language. They'll go, there'll be an almost relaxation. While we're all pretending that the elephant isn't in the room, it's much worse. So yes, so we shall encourage coaches to be brave in their questions and not to avoid.
Yeah, help people to find words for things. I mean, that's a big part of what we do as coaches, as well as what those of us who are therapists as well do. Yeah.
I just want to touch on the issue you said about self-development. Now, nearly every podcast we do, the coaches that we have on talk about supervision.
Yeah.
Do you want to talk about why supervision matters so much in regards to this particular issue with mental health, and with coaches being able to support their clients with their mental health?
Yeah. I mean, I'm a big fan of supervision. I couldn't imagine myself as a practitioner without it. In relation to mental health in particular, I don't know if listeners are familiar with the idea of the three functions of supervision that sometimes get named as the normative and the formative and the restorative. But if we take them in turn, the normative function just concerned with fundamentally the quality of the work and whether the work is of sufficient standard and whether it's maintaining ethical, appropriate ethical standards and boundaries. And supervision can really help you to think through the question of whether, as a coach, as a particular coach with this particular client in this particular setting, you're working within the limits of your competence or not, whether there might be a need to consider a referral and so on. There isn't a kind of one-size-fits-all answer to the question of where the boundary is. And it's a really important question, and supervision can just help you to think it through, and supervisors can offer you guidance on the kinds of questions that you might ask and so on. And then if we look at the formative aspect of supervision, about actually developing, that's about developing our capacity and our competence as practitioners. There's a rich opportunity when working with people who are having psychological difficulties or, touching on mental ill health, whatever precise language we want to use. Coaching can help us to grow both in our knowledge and skills, but also supervision, can help with our self-awareness as well. Supervisors can give us a space where we can reflect on what is my emotional and my psychological response to my client and their situation. How might that be pushing and pulling me in helpful or unhelpful directions? What personal development work, what reflection might I need to do in order to be able to maintain a better quality of a neutral presence with people who are in distress? And supervision can very much help with that. And then the final bit, the restorative, is just it can be hard and painful work working with people who are, coaching generally, although hugely rewarding, it can be hard and difficult work, but particularly if you're working with people who are experiencing distress, you can absorb it yourself and find yourself, if not vicariously traumatized, then certainly carrying stuff that is difficult to put down. And supervision can be a space where you can do that, where you can get stuff off your chest if you need to, say the unsayable things that wouldn't be appropriate to say perhaps with the client, name your fears and so on. So yeah, I think thinking about those three functions of supervision, they're all really relevant in relation to working around mental health.
Yeah, no, I agree. And it's also, I think, a sense of being responsible as a coach for your development, for being aware of what's going on inside you, as well as being able to take advice and have support on which direction you might want to take a client in that you might be concerned about. So yeah, it is. We do talk about it a lot on this podcast, but there's a reason for that. There's a reason. Yeah,
absolutely.
And every coach I've spoken to would say that supervision has been the most beneficial thing they ever did. And you can do group supervision if you can't initially afford a one-to-one. So there's lots of different ways of doing that, aren't there? So
yeah, and I think and group supervision can be hugely illuminating. Sometimes you might feel that you need a one-to-one because there are things that you just don't want to disclose to in a group of people. But particularly when you're a less experienced practitioner, there can be such rich learning in group supervision from seeing what other people are doing and what other people are having the same struggles as you, but also learning from how they are creatively responding to the situations. I think I would just want to touch on one thing in relation to this. I said earlier that my sense is a lot of coaches are perhaps overcautious about working around mental illness. There are some, I think, a minority and a fairly small minority who are undercautious. And again, that needs to be named. I encounter more people who are overcautious, but I know that I have experience of the opposite side as well. The challenge is that those are often the people who think they don't need supervision as well. And that's a difficult question.
That's a really important point to make, actually. Yeah, people that are under cautious and go beyond their skill set. It's actually quite an arrogant place to be in some ways, and that is actually a moment for self-reflection, I would say, in that regard. Because particularly mental health, it's still an area we need to learn so much about. There's always new developments in it. And none of us, I don't think, can really stand in that place of 100% knowing about this issue. So I think a very important part of understanding mental health is being open to new things and to listening to new ideas, new perspectives. Can we just talk briefly as well about the role of supervisors? And I mean, we've created with the AC some mental health guidelines for supervisors in particular, because they've got to be the ones to hold the space, as it were, for coaches maybe coming in with these issues. Have you got any thoughts about what sort of knowledge or training supervisors might need to do?
Yeah, I mean, supervisors need to have a theoretical understanding and an awareness of the fact that there are different ways of framing mental illness, psychological distress, different languages for it that have different connotations for how we practice and what we see. I think supervisors need to be aware, familiarise themselves with the signs of the more obvious signs of potentially serious mental health problems, so they can help their supervisees to recognise them. There are legal questions which will depend on the jurisdiction. For example, in relation to what you do in response to severe distress or suicidality. In the UK where I am, there's no legal requirement for you to do anything with an adult person who is experiencing or even suicidal thoughts, or even intending and announcing their intention to commit suicide. There's no legal requirement, but arguably there are parts of the world where there maybe, I'm not familiar enough with other jurisdictions, but there are really important ethical questions around how you strike the balance between the autonomy of the client on the one hand and the need not to do harm and the need to do good, and how to honour the trust that the client has placed in you when you're making decisions if you do decide that you need to breach confidentiality or terminate the work. Supervisors need to be aware, I think, of the ethical complexities. There are a range of principles that don't necessarily all line up. So, yeah, I think the knowledge and the practical skills, the ethics and the legal requirements are what springs to mind.
Yeah, you've said that really clearly, David. That's really helpful. Just thinking about what you said about legal and ethical requirements, I just wanted to think for a minute, I know about this confidentiality statement that we might give clients. I had a discussion once with some coaches because I was brought up I was doing work before that required us to know a lot about safeguarding, and I did safeguarding training. So when we talked about confidentiality, we always had to say, unless we think you might harm yourselves or harm others. Do you think coaching needs to have that statement in as well? Because there was some disagreement on whether that extra bit, and some anxiety actually about adding that on.
I think it's really important that both the coach and the client are aware of what boundaries there might be to confidentiality. So, as I said, that certainly in the UK, there are, in relation to confidentiality generally, we know there are some legal requirements around harm or potential harm to a minor, for example, or terrorism or money laundering and so on, where we are legally obliged to break confidentiality. It might be that some of the new protest laws have changed this, and it's something I've meant to look into. I know we're digressing a bit from the mental health topic, but I think it's important to be aware of those. In relation to mental health, it's more to do with ethics. And I think what matters is that coaches with their supervisors have thought this through. What are my lines in relation to this? So that at the start of a coaching assignment with somebody, there's a shared awareness that there either are or there aren't circumstances around mental health in which confidentiality might be broken. I mean, I say to my clients that there are some circumstances, if I am really concerned for your safety, there are circumstances in which I might want to contact another colleague about it, or a GP or a mental health practitioner. However, I would always do this where I can in consultation with you. If I wasn't able to do it in consultation with you, I will always talk with my supervisor or another experienced practitioner. For me, I think it's the process as much as the outcome. I think it's as a coach, we should think this stuff through. We should learn about what the law is, but we should also learn about the ethics, not as a sense of just a list of do's and don'ts, but what are the principles here?
Yeah, no, I agree with you. And that kind of rehearsal of what you need to say is a great thing to take to supervision, isn't it, as well? Yeah. And to think, what is my plan if someone says they're suicidal, for instance? What am I going to do with that? Or anything where they're very distressed, really. And it's not an easy thing to do, to break confidentiality. I've had experience of that. It's not an easy thing to do, but it is sometimes the right thing to do, for sure. Yeah, so thank you for clarifying that.
There are other instances, just to say, Maxine, as well as, suicide is perhaps the one that always comes to mind, but people can sometimes tip into what's usually a temporary psychosis, but under, an extreme amount of stress, that it can happen that people actually have a brief moment where it's certainly not clear whether they're actually grounded in, what we call consensual reality. And we need to be aware of, what we would do in a situation like that, because that would suggest that the fundamental assumption that we normally carry in coaching work, that people have sufficient adult autonomy to make their own decisions about things. If we think that actually that is temporarily impaired, then it could be argued we have a responsibility as a practitioner not just to leave someone to their own devices.
Yes, that's a really good example. Thank you. That's good. Just to go on to a topic of when to coach and when to counsel. Now,
yes,
I've met coaches and therapists who are very keen that you keep it completely separate. So there's no black and white, there's not much of a grey area in between. But then there's people like yourself have a more integrative approach. So would you like to talk about that and where you feel the boundaries are?
Yeah, I would say that research shows pretty clearly. I did a lot of research when I was writing the competencies for the BACP around this. There is no clear objective boundary. The boundary is negotiated between practitioners and clients, and it depends on a range of factors. The coach's level of experience, the nature of the contract, the setting in which the work is taking place, and so on. So there is not and cannot be, should not be, a one-size-fits-all answer to the question. What I would say is that a key distinction to bear in mind is that therapy is primarily concerned with alleviating distress and suffering, and coaching is concerned with the development of potential. Coaching can sometimes be therapeutic, but that shouldn't be its primary purpose. But as a result of that difference, therapy clients are in general more vulnerable than coaching clients, and this needs to be borne in mind. While coaching clients are not unvulnerable, and we need to handle people with care and respect, but there is a difference. So I guess, as you said in your introduction, my view is that whether you are somebody like me who actually works towards some kind of integration that in my case I call therapeutic coaching or not, I think both coaches and therapists can enhance their effectiveness by drawing on aspects of the other discipline. So therapists can use coaching at times to avoid that sort of endless circling of the problem and immersion in distress that can sometimes just feel like it's going to go on forever. And injecting some coaching energy can be really helpful, as long as we're doing it for good reasons and not because we're bored or frightened. And I think coaches can sometimes recognise, as I've been saying, the value of working with distress and working with emotions more generally. One of the reasons for developing our ability to work with emotions as coaches is that emotions contain really important information about what matters to people. So they're not just sort of things that get in the way. They tell us a huge amount about what people care about and what motivates them, as well as what disturbs or frightens them.
I wrote an article once called "Emotions Are Our Superpower."
Yeah, right.
So I'm in total agreement with you, and they're actually very much part of healing in therapy, aren't they? I don't think it's necessarily that different in coaching sometimes, because somebody's limiting belief comes from somewhere. It's not something we're born with. We're not born thinking we're not good enough. Something happens to us. So even in coaching, certainly when I work with clients, even just joining those dots without becoming too therapeutic about it, just seeing that, I remember when mum did this and that, no wonder I don't do this, or whatever thing is, it takes the weight off of the coachee's shoulders in that they don't think they're deficient or there's something wrong with them. It's rather that this more compassion comes into that space. But sometimes in those moments, you might get tearful. Why would you not? When you suddenly feel sad about the way your mother treated you on that particular issue, it's a natural, healthy response. So I find it interesting that in society we have this anxiety about emotions, which we still do. So I'm glad you brought up that word. Yeah. Well,
it's interesting to hear your experience. I mean, coaching is a fundamental part of coaching is raising awareness, and our emotions are part of our experience. And the more we're aware of them, the more we're able to harness them and use them in ways that are helpful for us and other people. And the less likely we are to be kind of pushed and pulled in ways that we don't sort of understand. I think, just going back to what you said about the people who say coaching and therapy should be separate. I mean, I completely respect people who choose to do that, but I don't think there is any sound argument for saying that they are two distinct things that should always stay distinct. I do not think there's an intellectually coherent argument that says you can't combine the two. And for me, it depends fundamentally on what the person requires, what the situation requires, and what the practitioner is able and willing to do. I did some research a few years ago into a coaching project at the local mental health charity here in York, and it was really interesting. These were volunteer coaches who were recruited, came in off the street, had a basic coaching training, and did 12 coaching sessions with service users at the mental health charity. And for some of the service users, the coaching was really transformative. And these were people with serious mental health problems, including diagnoses of things like paranoid schizophrenia or borderline personality disorder. It's really important to say this, they were held by the organisation, and they did have access to other support when they needed it, whether that was actually medication for psychosis or therapeutic support. But what coaching did was it enabled people to look at the parts of them that were still functioning okay and that were able to develop. And when you read the literature around recovery from mental illness, which doesn't necessarily mean getting rid of the mental illness, but it means recovering into a better life. One of the fundamental requirements is developing an identity that is separate from the mental illness. And coaching is brilliant for that because it focuses on what's still possible, and it focuses on the person's unique strengths and resources and their hopes and so on. For people who were really seriously depressed, coaching wasn't a good idea because without the foundational hope, it could almost be cruel to ask people what their goals were or what they want to achieve when they were just at that moment in a place of despair. But some people were seriously unwell psychologically, but could still benefit from the coaching. So, for me, that was just a game changer. Doing that research and discovering that, it confirmed for me that the idea that coaching is only for psychologically healthy people, I just don't think holds.
Yeah, that's a really lovely example, David. That's great to give that example to coaches, and hopefully that will help them have some confidence in what they're doing. I've worked in really vulnerable groups with young adults, sort of 20, 25, who coaching's made all the difference to them. Because as you say, everyone's got some skill or some talent that you can tap into as a coach, that you can build on with them. And that you find that out through questions, through asking them questions. And even in situations where I've been in, where they've come in the room very kind of negative and I'm useless and I'm this and I'm ever, then I start asking a few questions, and then you find that they're pretty good at football, or they're pretty good at organising their bedroom. I don't know. It doesn't have to be anything major, but you can use that, which I believe is what used to happen in brief therapy, when they had brief therapy, which is very similar to coaching, where you find that point of exception and then you just build on that. And coaches are very capable of doing that. That's in fact what, in a way, we're trained to do, I think.
Yeah, I think so. I mean, the point at which coaching and therapy probably come closest in terms of theories would be the solution-focused approach. It feels like the difference between solution-focused therapy and solution-focused coaching does depend very much on, what the person is looking for. A lot of the basic ideas and techniques are very similar, really. For me, what you say is absolutely right. It does, again, highlight what I would like to see more of in coaching, which is the personal development work, because what's really important is that whatever decision we're taking about how to work with somebody, we're doing it because we're actually gauging genuinely this is what this person needs, rather than, for example, I'm frightened of the difficult emotions, so I'm going to ask a load of solution-focused questions and kind of hope that the problem goes away. That can happen. I've seen plenty of trainee therapists do it, it's a kind of natural temptation. So for me, I think if coaches are going to expand the compass of what they do, work more holistically, a big part of that isn't just about the knowledge and the techniques and all that stuff. It is really having a good look at oneself and the personal equation. Irvin Yalom, the existential psychotherapist, calls the therapist's self the Stradivarius of therapeutic practice, and I think that's true of coaching too. This, that's the instrument. Our self is such a vital instrument.
And I think what my advice, you can agree or disagree with me on this, David, is sometimes we just need to slow down as coaches. If we are very goal orientated and solution focused, sometimes we can try and go too fast with a client, and they can miss out actually on some gems on the journey of sometimes just taking it a bit slower, because for some people it will take longer to find what they really want, actually, depending, as you say, on their history and their life before. So I think that can sometimes be a side effect of being a bit goal orientated, is to try and speed up and think, well, I need to get all the goals out in the first session. We don't. And many coaches will attest to the fact that sometimes it can be third session in before you're actually getting to what that person really wants to achieve.
I agree with you. Again, for me, what it calls to my mind is the value of supervision, because it's so hard to know, am I taking my time here because it's the right thing to do, or because I'm actually a bit allergic to setting goals, or vice versa? Am I pushing on with these goals because I've got a voice in my head saying this is coaching, not therapy, and I must have goals at the end of the first session? And sometimes it can be very hard to kind of second guess ourselves. And for me, getting regular feedback from the client about what they're finding helpful and unhelpful is important. But also, supervision is a space in which we can just explore that stuff and the complexity of it, and all of the pushes and pulls that we're feeling. And, am I being pulled into rescuing this client by something that they're doing? Or if we just focus on goals, am I actually colluding with the bit of the client that wants to avoid looking at something a bit more difficult? All those kinds of questions, supervision is a space where we can explore them.
Yeah, absolutely. David, it's been a really, really interesting conversation, and I think there's been some great information and some great tips for coaches in your conversation. Can you let our listeners know where they can contact you and find you if they want to follow up on more information?
Yeah, I'm on LinkedIn. That's probably the best way. And on LinkedIn, I posted an article getting on for a couple of years ago now called "What is Therapeutic Coaching?" that has generally had positive responses from people. And it's I'm not, maybe the title gives the impression I'm making a statement about this is what it is. I'm really saying this is what I do. This is how I go about integrating therapy and coaching, and the way that I think that can be beneficial for people. So LinkedIn. I also have a website, which is yorkcoaching.co.uk.
We'll put those in the show notes anyway, so thank you for that. And just before we go, have you got any sort of final tips or advice for coaches and supervisors?
Stay curious.
Yes. Yeah, great. That's lovely. Thank you. Stay curious. Yeah, stay curious. Lovely. Thank you, David. It's been a really lovely chat with you, and thank you for being our guest today. Yeah,
it's been a pleasure. Thanks for the opportunity, Maxine. It's been really good.
Thank you for listening to another podcast by the Association for Coaching. For over 20 years, our purpose has been to inspire and champion coaching excellence, advance the coaching profession, and make a sustainable difference to individuals, organisations and society. To find out more about the AC and our member benefits, follow us on LinkedIn or visit our page at www.associationforcoaching.com. Explore our new digital learning hub and enjoy our extensive library of on-demand webinars, signature programs, member benefits, interviews, podcasts, and a portfolio of live events featuring thought leadership, tools, models, and the latest industry trends to help you develop and increase your coaching expertise.